I am as good as I'm ever going to get right now when it comes
Yeah.
to function and form and the build.
Okay.
Maybe one day they will be able to control my pain a different way other
Okay.
than how I am now. That
Right.
would be awesome.
But it's
I
working though, right?
It
You're
is
have
working very
less
well.
pain. Yeah.
I have days where I describe to my friends having sex is sort of like getting drunk to me. It's fun while I'm
Oh,
doing it, but that
yeah.
next day it's going to be painful.
Oh,
That's how it is
wow.
for me.
Hey, everybody. Thanks for joining me today. I have an awesome guest today. I think you're all going to really enjoy. I get so many great people reaching out to me and these interesting stories. So I'm really excited to dig into this one. But before I move forward, I just want to say thanks for liking, subscribing to the channel, commenting, and getting this to people who need to see it. So with that, I have Toby today, and then Toby's going to introduce themselves, and then we can move on from there. Hey, Toby, thanks for joining me today.
You're very welcome. Thank you for having me. This is the first chance I've gotten to do something like this, so this is pretty exciting.
Awesome.
So, yeah.
Awesome. That's so cool. I love that. A lot of people who reach out to me never have done podcasts, but they always have such interesting stories. And your story really caught my eye because because it's not LGBTQIA pee pee poo poo. It's literally like this thing
Well, it
that
is pee pee.
right on, dude. It is PP, and everyone will see why he said that. But it just caught my eye because it's such a fascinating story, and it does relate on some level to the stuff that's going on. But why don't you tell us what it is that's going on with you, and then we'll go over
Okay.
from there.
Well,
Yeah.
I don't remember which of your shows I saw where it was clearly you're pretty defeated. You're pretty emotional about everything you had talked about.
Yeah.
And so I wrote you that email and I even put on it, I don't even know if you'll read this. Like I have no
Mm,
idea if it reaches the person.
yeah.
But, I was born in the late 70s with a condition called hypospadias. I've come to learn there's actually another sister thing to it, but literally what it just means is at birth, the urethra didn't develop the way it should have. And you can have
Yeah.
an ending close to the end of your penis.
Uh-huh.
You can have an ending or an opening all the way back by your scrotum, and anything in between.
Okay.
And being that it was the 70s, they didn't have like the micro technology they do now.
Uh-huh.
Um, so my surgery, for all intensive purposes, was botched. And
Oh.
it left me with a lifetime of issues. And that's why with these kids who are transitioning, especially early before their bodies have developed, it's
Yeah.
making me really angry because I didn't ask for this,
Yeah.
but these kids are asking for it. They don't
Yeah.
know what they're doing. They're not that developed and smart enough to know what they're asking for, but they're asking for problems.
Yeah, it's true. That was the thing that caught my eye. So was the fact that you had this surgery, and we'll dig into more of that, but you really did um, say you were concerned because these kids are, and when we say kids, I think I mean, I interviewed a kid who was a boy who became a girl, and he got his surgery at like 16, which to me is still a kid and a boy, and they removed his penis and made a vagina at 16. And I remember I was like, when I saw your story, I was like, what? I never even heard of this. Is it common? How do you pronounce it?
Hypospadias. It's
Spadias.
actually fairly common. I read,
Wow.
depending on who they ask, every 1 in 300 births. Which
What?
if you think about the size of America, I'm not great at math, but that's a lot of people. But I think
Yeah.
the reason it doesn't get talked about is it's embarrassing.
Okay.
It's just embarrassing. Like, I mean, who I
Okay.
don't want to talk to people outside my doctor to explain why
Yeah.
things aren't going the right way and why
Yeah.
have I had such a difficult time with it. You know what I mean? I think it's
Right.
just and you know how it is. Everybody, when you're a guy, that's how you measure your guyhood. You know what I mean?
Totally.
Is like if
Totally.
you are born with an issue, boy, you just gave yourself a bad time, So
Oh
I can go
no.
deeper into, exactly what happened and
I do.
things
I
like
want
that.
so the urethra is not fully extended through the penis. Is that how it is?
Correct. You will get the opening somewhere back along the shaft. There's actually a sister
Oh,
condition where it could be hypo, meaning underneath. You can have
okay.
it on the upside too. Same issue. The hole will be somewhere, not where it belongs,
But
but
there's an actual hole.
yeah, I was born with a hole. It was just way back
Like
farther than it was supposed
where
to
like the
be.
testicles are or something.
Exactly. And what
Wow.
happened was, so they did the surgery, they build you a urethra.
Okay.
I was told that the doctor probably, I can't get the medical records, they're from a million years ago,
Mhm.
but they did not treat the graft for hair follicles.
Oh no.
Yeah, and oh God, I don't hate to mention this person, the cake pop person.
Yeah.
And they talk about how they don't want hair in their inside.
That's right.
Well, that's what
That's right.
happened to me. And
Oh
what
shit.
happened was, after years of this going on and on and on, I ended up constantly getting UTIs,
Yeah.
testicular infections.
Yeah.
I had to have the graft actually replaced when I was around 30. They actually replaced the graft, and so things got somewhat better.
Okay.
But unfortunately, the damage had already been done.
Okay.
And part of that damage is I have chronic pelvic testicular pain.
Oh my
Um,
god.
and because it just ruins the nerves. Under everything they write it as neuropathy, which is just the
Okay.
generic term for your nerves are setting off pain.
Yeah.
So right after I got married, I got
Uh-huh.
a spinal cord stimulator, which is, I don't know, it's about the size of a pacemaker, and
Okay.
they dropped a couple of leads down my spine or through the spinal column, and it tickles my nerves just lightly with electricity during the day.
Oh wow.
And that helped, but it did not help to my satisfaction. So we did take the next step, and we went and got. Some people may have heard it as a baclofen pump. Mine specifically has morphine in it, combined with another drug.
Wow.
And so on one hip, I have the electronic device. On the other hip, I have the medical pump. Every 6 weeks, I go in, and just like a gas filling of your car, they
Hmm.
jam a needle in there and fill it back up. And so that thing's constantly running through the down under my vertebrae into my spine and numbing everything that way. Um, so
Wow.
it doesn't go through the stomach like oral meds do. So I
Okay.
don't get that high
Yeah.
that other people will get when you're given pain meds and stuff. But
Yeah. Yeah.
that's the combination we've had to go through to deal with
S-
this.
So does it affect you in any way? Like you can't, only thing it does is stop the pain from happening. It doesn't affect you the way you feel or anything like that.
It depends on the med. We went through some trials with some
Okay.
meds that were very different. Actually, as you've talked about many times,
Hmm.
it was getting put on top testosterone that really messed me up the worst. I was tired all the time. I was
Hmm.
moody.
Hmm.
Well, of course, doctors are like, yeah, all this damage you've had down here all these years,
Yeah.
your testosterone, my testosterone level was
Yeah.
50 when it should have been like anywhere from 6 to 900.
Wow.
And nobody told me narcotics can block testosterone. If you're on a narcotic all the time, whether you're a drug user or a patient, it will affect your testosterone.
Oh
And
wow.
so now I had to go into that shot. And
Oh
honestly, the
wow.
testosterone has given me worse issues than anything else. I cringe when I hear these people say, "Oh, I'm getting testosterone," woo-hoo, and I'm just like,
Yeah.
"Oh man, you're not in for it."
Why do you think so did it affect it affected your testicles maybe and the production of testosterone?
That's
Did
my
it?
guess. That's their
Yeah.
guess, is that
Yeah.
anytime you have constant irritation, constant. Although it could be anything, Buck. I also
Sure.
have. I was a preemie when I was born, and
Okay.
my whole life I was that kid that got sick all the time. My brother and
Mm,
sister never.
mm,
My parents are in their 70s and they still don't
mhm.
go to the doctor. That's just. But me,
Oh, but you,
if I'm
yeah.
not, I was that kid. Well, I finally found out when I was 40 that I have a weakened immune system, and officially a weakened immune system.
Wow.
So on top of everything, every time I was getting an infection
Uh-huh.
for this, my immune system wasn't strong enough to put up with it. And I had two times when I was so close to full blown septic shock that, I rather not be that close to it ever again, because
No.
it's scary. I
Yeah.
remember just losing my mind and waking up in the
Yeah.
hospital days later asking, like, what the heck just happened. So,
Wow.
yeah. And so, I see these kids just so excited that they want to take something that they
I
were
know.
given, and
Yeah.
for the most part you got to figure is working correctly, and to invert it, get rid of it, whatever they're doing, try to build one. It's just an area that does not need to be messed with. Now,
Thank you.
I'm all for you. You were an adult, you knew
That's
everything.
right. That's
Those were
right.
your choices.
Yes.
You took that risk. And fine, I'm fine with that. If you're an adult, do it. I don't tell people how
Even
to
as
live
an
their life.
adult, let me tell you, if we're going to talk about the male region, the penis, I don't have that. I think I'm pretty open about that. I never
Mhm.
got that surgery. I transitioned 33 years ago. It was hardly even a thing, but it was thing. When you want to become a man, what's the first thing you think about? A penis. You actually do. So I was like, oh my god, I always wanted to get a penis, and but looking and watching and knowing other guys that did it back in the day, I was like, no, because it's insane, dude. They take like this thing here and they mold it and they do, and you lose your sensitivity. And today, more than ever, trans guys are getting these penis surgeries that do not work, dude. I totally hear what you're. I mean, there's only so much as a transsexual. There's only so much you can do, right? It's a real thing. Like I can't get a penis. It doesn't work. I don't know why you would want to have something like that, and so sometimes you just got to like weigh the pros and cons of things. For you, you didn't really have an. How old were you when they know, like right when you were born, they noticed that your urethra was like
Yeah,
that?
it's something. There's a checklist of things they check on every newborn, and
Oh,
it's actually the
oh,
only more common issue is undescended testicles. You've heard of
yes,
that in babies.
yes,
That
yes,
this hypospadias or epispadias is
yeah.
the second to those things. So I
Wow.
guarantee you there are people out there right now, or guys that are
Yeah,
totally understand what
yeah,
I'm going through, which
yeah.
is helpful. But guys, they don't talk about this
They
stuff. I
won't.
don't kumbaya with a bunch of people who are like me. I mean, I don't do it. I'm masked like this for a reason.
Yeah,
Partially the people out there who are a little, but for
dude, the
my own
crazy internet.
privacy. Yeah, right. My
Yeah,
own privacy. I really don't want to become famous for having this condition. That's the last thing I want.
sure, of
But
course.
I hope that guys, and more importantly, these kids hear this, that look, you
Yes,
are taking an area that is questionable at best right now, and
yes.
you're gambling on this surgery. Yeah, if it goes wrong, or as you've seen, if they
Thank
try
you.
to reverse it,
You
they're in for.
can't. You can't reverse penis surgery, by the way, or even vaginal surgery. Once you cut your penis off and get a vagina, or once you add a penis, you're done. That's it. There is no. I know guys who got gangrene, dude. I could tell you stories of. I'm like, why are we even promoting this in the trans community? Why are we acting like these things are going to help? That's the thing I keep trying to say to everybody. You better make and understand when you transition, you're not going to get everything. It is not an easy place to live. I had to really get my head around that that I have a vagina, and that I can't go hang out with dudes in the locker room and be normal dude, if that makes sense. Did it affect the size? I mean, is that too is
No,
that
it's
too
not. It's
personal?
a
Yeah.
very common side effect is size. By
Okay.
definition, I don't know. Everybody throws that god awful term around, micro penis. I
Yes.
don't know if
Yes.
like I've officially fall in that
Yes.
area. I have no
Okay.
idea. I'm
Sure.
not asking to find out if I. But yes, definitely. When I got to high school and you do your first gym locker thing, you're like, oh, yeah,
Yeah.
something's not right
Yeah.
here. You know what I mean? Every kid's gone through that. You know,
Of
every boy. You
course.
know, unless
Of
you
course.
happen to be the one slinging it around. You know, everybody else is, sort of like this. And
Normal. Totally.
yeah, yeah,
It's
and honestly, I've been married for almost 17 years now to a nurse,
excellent.
which was very nice. Um,
Excellent.
and yeah, I can, we can have sex together. Everything is
Great.
fine, but there's no way I could get her pregnant. It took my
Oh.
fertility, and
Oh.
testosterone does the same thing. Testosterone can lower your fertility rates. So I went
Oh.
and had the test done, which is embarrassing as heck. You go in a room and drop a drop a
Yep.
load, and
Yep. Totally.
they called me back and they were like, "You're no, there's nothing."
Nothing.
They're like, "There's a few there, but they're like swimming in circles or something," and
Oh,
I'm just like,
wow.
like great, and I got to tell my wife that like literally right after we got married, so
Oh. Yeah,
that was pretty rough, you know.
oh
So
man, I'm so sorry, but so you think all of so what affected it? You think just the surgery or all the pain, all the stuff that you've been it just
I
lower
think it goes back
testosterone?
to the infections. I just think it goes back to the
Oh.
infections. And
Oh.
I have been on antibiotics. If I had to guess the amount of time I've been on antibiotics versus not being on antibiotics,
Whew.
I, and that's
Ooh.
kind of why I almost went to sepsis a couple of times. I've
Yeah,
used every antibiotic out there 700 times. Well, now my body's just like, I don't,
that's right.
So unless they come out with a new class of antibiotics anytime soon, I'm always at the risk of getting an infection that is going to kill me because of this. And
Sepsis.
so, I do the whole COVID thing. We had just moved into our new house during
Uh-huh.
COVID or right
Uh-huh.
at COVID.
Uh-huh.
I didn't leave for almost 2 years unless it was a doctor's appointment because I know my system is so weak after all of this that
Yeah.
it's kind of Russian roulette for me, So, and it all goes back to, if you want to get dramatic about it, it
Yeah.
all goes back to day one when I was born, and the
Yeah.
little dominoes got knocked over, and it came back to bite me in the butt later.
But so back in the day when you got the surgery and they didn't have the I guess the better surgery they have today, they just sort of reconstructed a urethra for you so that it was connected the right way so you could pee out of the end of your
Yeah.
penis,
Now,
right?
yeah, I've always, and another very common side effect of this is I've always had a very interrupted stream, which for anybody who
Oh,
doesn't understand,
yeah.
you spray instead of that
Okay.
nice little tight,
Okay.
drop into
Yes.
the toilet. Mine is,
Right.
so honestly, I
Right.
sit down way more often than I stand up.
Thank you.
I
There's
mean,
a lot
that's
of
how I have
dudes.
to do it because if I don't want to clean my own toilet 700 times, I'm better off
I love
sitting
it.
down. Like, and you've seen
Yeah.
guys' restrooms. You imagine sitting down in some of these.
Disgusting.
So I carry antiseptic wipes because I have
Yeah,
to.
you
I'm
have
not getting
to.
myself on that petri dish. I
I
have to
know.
stay healthy.
Right on.
So
Petri dish. No, it's true.
it's
Men's rooms
horrible.
are
Guys are
dudes piss
animals.
on. They're
Oh,
animals, dude. They piss. I mean, don't get me wrong. Women can be gnarly too, dude. I've been in both. Just so you know. So there's grossness on both sides. Not women are not all clean anyway, but dudes do. They seem to piss on everything. It's like the most bizarre. Like they just like they're not looking.
I
And it's
know.
like,
I know. Sometimes I try as hard as heck to get home. Like I will literally adjust my
wow,
schedule just so I can go home and do it in a
wow.
clean, safe environment.
Oh
And
my
at one time in
god.
my life, I had to catheter for 3 times a day, which
What?
that was miserable because
Oh,
when they did the graph, they did it as well as possible, but not uncommon for the graph to have a bit of a bend, and mine does. It has a
okay.
little. Can't remember if it goes left to right or right to left. I don't care.
Okay. Yeah.
But when you take a catheter and now
Yeah.
you're trying to slide it back up in there, you got
Yeah.
to learn to get around that corner. Well,
Oh,
that was
wow.
not a
You
fun
have to do
time.
it yourself. You have to catheterize yourself.
I don't anymore, but
Oh,
for about 3 years I did until
oh,
and they couldn't figure out why I was having such issues. So they wanted me cathetering and
oh,
getting to get everything cleared out
cleared
100%.
out.
Because
Yes.
another side effect of all this, or another, I shouldn't say side effect, another common issue with this
Mhm,
is
mhm.
not completely emptying your bladder. And
Oh,
this is for women too. This
yeah,
is,
sure.
if you don't happen to, if you leave 10% in,
Uh huh.
that 10% can very easily turn into a little boiling pot of infection. So for
I
three
didn't know
years, they
that.
wanted me to catheter to make sure that when
Wow.
I was done, I was truly done.
Wow.
So not something that I would ever wish on my worst enemy, because that was the one time I was happy about being on the smaller size, because I was like, oh man, this
That's
must
right.
really, really suck for the rest of these guys.
Oh
Because,
yeah.
you know,
Oh,
it,
being
it,
cat, even like me not having that, but getting catheter. If you've never out there ever had one, it's horrifying. It. So can this happen to a female as well?
not this specific
Yeah.
thing, because it
Yeah.
has to do, I am no doctor, especially when it comes to
Sure.
biology, but because the women don't have an
The shaft.
appendage that comes, yes, a
Yeah.
shaft that comes
Yeah.
off, I
Yeah.
don't think that
Oh,
happens to them. I've never heard of it happening. Don't take my
okay.
word as
No, no. I'm
gospel
gonna look
there,
it up.
but
Actually, it might
yeah,
just be called something different,
exactly, and
right?
that's very possible. It probably falls under an umbrella completely. And this
Yeah.
is where I really shake my head, where
Yeah.
these people are trying to tell us there's no differences in the sexes. And I'm like, I'm
I
pretty sure
know.
there are,
I'm pretty
like
sure.
last time I checked, like, I mean, I'm not a porn addict, but I've seen, and I'm like, yeah, we're different, so,
Yeah, dude.
so
And
it
also,
just,
why are you transitioning if we're not different, right? Like, what are you transitioning to and from? The whole thing is so absurd. It's actually
well,
that whole movement is actually transphobic. That's real transphobia, dude. They're like creating their own transphobia within that space, saying stuff like men and like females and males aren't real, or I'm really born a woman. Then why are you transitioning to a woman? Like, what?
yeah, yeah.
What?
You had a lady on a what, was it Alexis?
Oh,
Who
maybe, yeah.
she
Alexis
said,
Blake.
"Hey, I didn't realize I was smaller," and so she didn't get
Yeah.
the full blown surgery. She got the more,
Yes, that
a little more like.
Samantha. That was
Oh, was that Samantha?
Samantha.
Okay, please
Yes.
apologize to
No.
Alexis. I
Oh,
didn't.
please. It's all
That's not
good.
something I meant to do,
Yeah. No, it's
but
fine.
I almost am happy for her, because she didn't at
Yes.
least go down the whole horrific route of
Oh, the
re
other one.
yeah, I don't I don't know why anybody wants to do that to themselves. And it
I
has nothing to
don't.
do with politics or
No.
any of the
No.
identity stuff. It has to do
No.
with, your body is an amazing machine, yet it's also
Yes.
very, very prone to breaking down.
That's right. I
And
mean, I'm so lucky. I'm 63 and did this for 33 years. I'm pretty healthy, dude. But I think because I did the minimal, right? Like I just did this and shoot testosterone, but I'm not steroided out. I take 1 cc of testosterone every 10 days or every week, right? And
mhm,
that's it. That's it. And I work out and I eat right and I also take medicine for my liver, so I didn't get toxic, and I didn't drink alcohol, and there's all these things people don't talk about that, but I think it's different from a. It's a lot harder, to be honest with you, to transition from a man to a woman than it is from a woman to a man. There's much more
well,
complication.
and not that I was trans or intersex, but
Sure.
my body is actually a very good example of why adding on is a lot harder and a lot riskier and a lot more
Yes.
dangerous than the other way. They
Yes.
tried to add it on, and unfortunately, it didn't 100% go right. My understanding right now, like we said, is one in every 300.
Yeah.
God, if you have the stomach for it, you can watch that surgery online. I can't do it,
I don't know.
um, but I think another reason you don't hear so much about it is
Yeah.
because they're fixing it. for these kids. You know what I mean?
Oh.
Just because you were born with it doesn't mean you now have a
Oh.
lifetime of horrors in front of you. If they're able to fix it and fix it well, that kid could then go on. Now, what they might do when they hit puberty is
Yeah.
give them some extra growth hormones to let the
Okay.
whole body as a whole, and that's
Okay.
something they never did for me. I should have probably been put
Oh.
on growth hormones
Right.
in that time. We missed that window. And so when these kids talk about going on puberty blockers,
Oh.
I'm just like, oh no, you're
Yeah.
taking a bad turn here.
Yeah.
And I wish I had I wish I had the gall in me to walk straight up to people and shake them and warn them. I'm not like that. That's not my style.
Yeah.
I'm definitely a lot more laid back and watch it. But
Yeah.
when asked for an opinion on the matter, I will give it. And it has everything to do with, Jazz. We all know Jazz. Does
Yeah.
she look happy with
No,
what
she's
has
not.
happened to her?
She's not. She's
Her
not.
mom is
No.
always talking about forcing her to do things, and I'm like,
Crazy.
that poor person doesn't even know which way is up and down anymore, you
Well,
know?
my God, putting their own child on a show and talking about the kid's vagina and doing dilation, and literally your whole life is in front of the world, like no privacy. Of course, it's got to affect this young person. There is no way that it's not. And I just see a train wreck there. I do not believe that. Remember how big and heavy they got? That's a sign of depression when you become a sort of obese, like she
Yeah,
did.
yeah. Well, as you said,
Yeah.
testosterone. If you're going to guys out there, if you're going to have your testosterone looked at and managed,
Yes.
please, dear God, please go to an actual doctor and not one of these clinics where literally the secretary just
Totally.
shoots you in the butt. Because
Totally.
and this happened to me when I took
Uh-huh.
my first testosterone, I went from 50 to 900 overnight. I
Wow.
was kicking holes in the wall. I started gambling. I was
What?
so pissed off all the time that I didn't leave my house. Like I had the full blown roids rage.
Yeah.
And that is seen as a drug, like, oh, we'll hand that out as candy,
I know.
Anybody who
I
wants
know.
it will give it to you.
Yep.
And I'm just like, oh God,
Yep.
please. Well, I mean, I'm bald too. That was
Yeah.
just genetics, but
Well, it's
it can,
genetics too. It's only because I put the test. Not everyone who takes the testosterone, it's full genetics, but that's also a. Depending on how you look at it, I actually like being bald. It's so much easier.
I do too. I don't have to pay to go see anybody. And yeah,
Totally. I'm
exactly.
all for it. But some young people might not want to have, premature balding and all of the other things that come with that. So you got hair. I want to go back to the hair
Hmm.
growth in there because that is very important. And
Hmm.
that happens in both of the transsexual surgeries from male to female as much as from female to male because they take pieces of the arm and tendon that can have hair follicles in it. And that is part of the thing that people aren't talking about. The fact that hair growth is happening in there, and it's got to be extremely painful.
Yeah. So I love my parents, but a couple of things. My dad growing up, he constantly was getting laid off from where he
Okay.
was at. No,
Okay.
no fault of his own, but it meant that we often were jumping from one insurance to another,
Mm,
and some of them were very, very poor.
mm.
And everything my mom and dad went through when I was just that baby. I was that kid that seemed
Yeah.
sick all the time. They
Yeah.
sort of are a little bit like, doctors are quacks. So it wasn't something I really want to go talk to my parents about. But the
Sure.
first time I saw some of it actually stick out and come out, I was in like a junior in high
Oh.
school. I flipped the F out.
Oh.
I had no idea what it was. It was white because it had never seen like the light of day. It had no
Oh my
pigment.
God.
I
Oh.
thought I thought like I ruptured inside or something. I
Oh.
had no freaking clue.
Oh.
So when the doctors finally started, I don't know if you've ever been scoped before, awake. Oh,
Oh,
that's
wow.
finally they're like, lay down and bite on your arm because we're going to
But
look up there,
oh my God.
And
They
they
stuck a
did.
scope down it.
Yeah, yeah. And they always prep you the same way. They send the most beautiful girl in the place, and she takes a syringe full of lidocaine, numbing
Oh
medicine,
my God.
grabs your,
Yeah.
jams it on, and then and supposedly gets it all nice in there. See,
Oh
but
my.
because of my bend, mine
Oh.
comes back out the other. It just doesn't stay down there. So when they
Oh.
do the scope, I'm not numbed most of the time. I
Oh
just
my
not.
God.
So when
Wow.
they finally started seeing the hair, things started making sense. I was like,
Oh.
oh, this is what's going on. I never in a million years even understood why this was happening or
Oh.
what it was going on. It's just what it was. And so it was sort of a relief to finally be like, you know,
How'd they
so,
get rid of the hair?
so that one time, basically, they went in and did a haircut just under anesthesia this time. Thank goodness.
They like stuck some kind of thing down there and like just trimmed it out.
Hmm.
But wasn't it going to grow back?
Yes, that's why when I turned 30, I went and saw a pediatric
Uh,
doctor and had it
oh.
full. The only doctor in the whole area who would do it is a pediatric doctor. So I
Wow.
ended up at 30 years old on
Wow.
the pediatric floor of a
Wow.
of a pediatric hospital getting over
Wow.
this surgery. But yes, it's when they finally said enough is enough. We're going to take this part of the graft, get rid of it, build them a new
A
one.
new one.
And then they sent me home a few days later with a Foley catheter. And, you're dragging the bag along.
Yeah.
And I went and got it taken out. And then the guy says, okay, when you get ready to go to the bathroom for the first time, if you see your testicular area, your sac start to bulge, that means that the urine is not reaching out the end and it is going into your sac. And I need you to get back to the ER as fast as possible.
Yeah.
So
That's so
let's say
dangerous.
that I was never more scared to pee in my life that
Oh
time.
my
I was at my
God.
parents' house, convalescing at my parents' house,
Yeah.
and I was like, "Oh my God, I gotta pee." But I don't
Oh,
want to see, I don't want to do this. You know what I
oh
mean?
my
But finally
God.
I had to. And thank God everything worked out. Like everything was fine. It did
How
not
did they do
happen.
this? That is insane. I mean, my God, the stuff you've gone through. What is that? When so they removed the old urethra that they built, and then they made a new one. And then how do they do that surgery? They just like,
I see what you're doing. No, no, no. They flay
oh,
it open.
oh, oh
It's
my,
not like they're
right.
not doing it from like this. No, no,
Yeah,
no. And
they
that's why I
actually,
said
oh,
if you have the stomach to watch the surgery, they fillet it open like this so they can
wow,
get into where they need to and stitch it
wow.
all up. No, they do not go through the end and do
They
it
open
that
it
way. They
up.
have to lay it down nicely. They
Right.
have to attach it. They have to make sure
Wow.
that it takes and that sort of stuff. And so
Wow. How
right
do you
after.
heal from that? Do they just like, I mean, it just seems so crazy. That's like your genitals. And like,
Uh-huh.
and then can you pee and stuff right after? You have to use a catheter
Well,
immediately.
yeah, I think I mistook the naming. I had the catheter that was hooked to the bag. It didn't come
I
in and
see.
out. I think I
Yeah.
was on
Okay.
that for 10 days maybe.
Wow. As it
Um,
heals.
yeah, they don't want to mess with the area and
Yeah.
stuff. And, having a catheter, I don't know if you ever had one, when
I've
they take
had.
it out, you
Ah,
get
it's
that like
so gross. Oh no, I
feeling, you know
know.
what I
I know.
mean?
I
Well,
know.
they had to do that to me on top
Oh.
of that was the area that had just had surgery. So
Oh.
it hurt,
Dude, you went through so much pain in your life. I mean, I'm not laughing. I'm just like,
No,
I
no,
want to
no, Buck.
cry. Like,
I have
what?
the darkest sense of humor of anybody who knows me. I do, but because to me it's all a joke. Like,
Well,
when you
yeah,
deal with these sorts of things, like,
that's
you
right.
hear these
It's
kids
good.
from Harvard complaining about things and you're just like,
I
"Oh
know, dude. I
God."
know. I hear you.
Like, "Oh,
Uh,
just take some form of stop and like be thankful you were born healthy," and
Thank you.
you know,
That's
and
so great.
yeah, if anybody's ever had a kid born with any ailment,
Mm,
what a stressful, horrible time
totally.
that can be. My wife is a pediatric nurse. She used
Oh,
to work in an ICU, so she's seen it all.
wow.
And she just hates when
Wow.
people don't respect what they were
She
given.
must be freaking out over this whole kids and beauty blockers and insanity that they're doing to kids. She must be losing it. I can't even imagine. Like,
Well, honestly, right now, I don't think she quite gets it because she's so busy at work and
oh,
stuff.
thank God. She
I
doesn't need
tell
to
her
see it.
about it some when she gets home.
Yeah.
Just so I don't work. I'm on disability right
Okay.
now.
Okay.
So I have time. You know what I mean? Like, so I have the time to go down these deep rabbit holes and
But
educate
thank God
myself.
you
And
do, because you wouldn't have met me and we would not be having this conversation, which is an important conversation
it
because
is a very
you do
important.
align with what's, I mean, as a person who was born that way and understanding when a kid has these kind of ailments going on, these kids are, the thing is, you're born with that, dude. These kids are being given that ailment, right? Like you're not, I just telling you, kids can have dysphoria. There's no doubt about it, dude. But that is something that they can most almost all the time they grow out of it. It's very what I did is rare, dude. It's always been rare. But all of a sudden now thousands of kids are trans. No, they're making these kids have these ailments, which is to me the more disturbing. You were born with it,
Yeah.
and there's not anything you can do except for sort of move forward. But how dare
Yeah.
we do this to a child?
And I've been in therapy a lot in my life. I've
Sure.
had a few really good ones, a few really bad ones,
Of
but I've
course.
had one who I don't see her weekly right now, but she's
Mhm.
still considered. She was amazing, and
Mm.
and we talked about that these kids aren't even asked to go do the smallest amount of therapy.
I
And if
know.
they do, it
Yeah.
seems like the therapist is sort of, from what I'm being here, it's
Yeah.
sort of like they're telling them, this is what you need to say and jump through
Exactly.
these little hoops.
Exactly.
I get to keep my license. You get to get what you want. And
That's right.
then we're done.
You're right.
And that's sickening. That's sad that there's even therapists who are willing to do that, you
They don't
know?
have a choice. I've interviewed like 5 therapists and they're going to lose. But what they do is they get out of the trans space and they go just do regular therapy, but they don't have a choice. They're
Ah.
actually shoved into this. It's gross, dude. It's so actually gross. But now the therapists, little by little, we've been blowing the whistle on this and said, that's indoctrinate. That's not therapy. Therapy is to push back on you and say, hey, wait a minute. We're going to give you time. We used to do a thing called wait, watch, wait, and whatever. So you waited, you talked to the kid, and you waited for a year or two. We had gatekeeping, right? Now it's just like, yep, okay. The kid said they're 10, and they said they're trans. Right on, we're gonna get you on puberty blockers. It is, it's just, I don't even know what to say about it, dude. But
Well, that
there,
makes me feel better. I mean,
yeah. I mean,
you know what I
yeah,
mean? Like, it's not a
yeah,
great situation. At least I
yeah.
feel better because I actually have great respect for therapists.
Me too. Me
They don't
too.
make the kind of money they should,
That's
and they
right.
literally sit there all day long and take on the
Yep.
world's problems, basically. And I don't know
Totally.
how they did it. I used to volunteer for hospice,
Oh,
and after
great.
a while, I loved it. I loved every minute of it. But
Yeah.
after a while, it starts to wear on you because
Sure.
you're taking on other people's
That's right.
problems. And
Mhm.
I'm trying hard not to become numb
Mhm.
to people and their problems and
Mhm.
stuff. But with with all this social media just beaming to us all day, every day, you have to learn to put up and this is what the
That's right.
parents don't understand is when you make an iPad the babysitter,
Oh,
that opens up a whole world for them
oh,
that you have no idea.
that's right.
And you don't know what you tell the kid to lock the door when they get home
Mhm.
and then let them on the internet.
Wow. I know.
I'm
It's
more
like,
afraid of the door.
well,
Not afraid of the door. I'm more afraid of the iPad, not the door. You know what I mean?
100%, dude.
And I have nieces and nephews who are right in this age right now. And I'm just
Oh,
like, oh, please, dear God, and they live in California. That's what scares me to
oh,
death.
that's where I live. It's
Yeah,
scary here. I
exactly.
have a kid and I'm actually adopting a kid. And so the thing is that no, dude, no, we're like outside or, what's going on? What are you playing? That's why I always have him playing the PlayStation out in the living room, not in his bedroom. So we're just straight up watching everything that's going on. You can't get them out of the video. He's a nerdy little kid. So he likes video games and that's his nerdy friends and Dungeons and Dragons and all that crazy shit. But that being said, we got our eyes on that. You can't not let them do that, but what you cannot let them do is go in the room, shut the door, and get on the internet. Like
Right.
that is bad parenting, in my
Right.
opinion.
Right.
Right
I'm
there.
so glad that I'm 40. I'll be 48 pretty soon. I'm so
Excellent.
glad that I got through high school pre cell phones
Dude,
and
totally.
because these kids are, I honestly believe this whole thing is more of a social
Yes.
disease
Yes.
than it is a actual mental one like you suffered with and needed
Yes.
help for. It really feels more like a social, it feels like
It
we're
is.
all giving each other an STD that is this. You know
Great
what I mean?
point.
Like of
Yes.
all of those people, probably two are legitimate. Everybody else
Yeah.
jumped on this weird bandwagon. And
It's scary.
I
It's
hope that kids can start to learn to, kind of think for themselves if it doesn't, look to see if they're getting pressured. But, kids are kids. Like
that's
the worst
right.
thing of being a kid is
That's
standing
right.
out. At least it was when I was a kid.
It's still the same. Are you kidding me, dude? It's never
Yeah.
going to change, right? There's still bullies. There's still cliques. There's still, you don't want to be the one kid who stands out. Of course not, dude. You will get bullied up the ass for that. So did you stand out when you were a kid or that just because it's so private down there, no one actually knew what was going on or
No one knew what was going on. I
yeah,
I didn't
yeah.
tell anybody. The whole
Wow.
gym thing, I basically did the quick.
Wow.
I was lucky. My gym was at
Quick.
the end of the day, so
Oh,
I
right.
didn't have to take a shower, and
Yes,
I could just pack my bag and go home.
that's
And
right.
so yeah, but I
Did it
mean,
affect your sports or affect you in
not
sort
sports.
of
It definitely affected dating. Like I did not
Oh.
date very openly.
Oh.
It was really hard for me to, because
Yeah, of
you got to
course.
explain to that person, like,
Sure.
I'm straight. And so, but
Yeah.
unless she's completely clueless, she's seen another one and she's going to
Yeah.
notice a difference here, so it
Yeah.
definitely affected my
Oh.
dating and stuff. But I don't want people to feel sorry for me. I've been married now to a great woman and we've both made it work for each other.
Well, you seem just like a cool dude. So that's secondary, right? Or third, or even fourth, or even fifth, right? That the size of that. I think we, as guys, that's always been a thing. We put that all that sort of pressure on dudes to how big is your penis, and like how macho are you? I was just talking to another guy I interviewed about that. He was a very shy. Oh, I just did an interview with a kid who transitioned. He was a boy who became a girl at 17 or 18 and because he was kind of an effeminate boy and so he was pressure, he didn't want to do sports, he was kind of nerdy. So see the pressures we put on young boys, and he just transitioned because he thought he was feminine, that he had to be a woman, he couldn't be a man because he was feminine. So
Yeah,
it's
I'm not a big conspiracy person. I'm not, but I kind of feel like when these people lost opioids as the thing they could push and make a ton of money on, they
oh,
needed
good
something else
point.
to take the place. And it to
Good
me
point.
honestly feels like blockers are the thing that took their place. Because
That's right.
I've never gotten them myself, but I'm guessing they're
Yeah.
not cheap. I don't know.
Oh no,
But
dude, they cost hundreds of thousands of dollars.
so there you go.
Hundreds of thousands. Not only that, I mean, the cheapest part of all of this is the actual estrogen or testosterone. It's not expensive.
Yeah.
So what do they have to do next? No, that's not a conspiracy theory. We're all pretty on board with that. We believe they were creating a system, right? So you can once you're medicalized, you're medicalized. You're medicalized for life. I'm medicalized for life. We have to rely on drugs and certain kinds of things.
Yeah, I mean this condition has affected everything in my life. And I
Wow.
don't want, I mean, like I said, I don't want people to feel sad for me because I mean I do have a
Yeah,
good life
sure.
but I did have to give up a career that I loved because I
Mm.
was always in too much pain and too much and
Oh,
too tired. It was like they were misusing the FMLA paperwork against me. So if I
Oh,
missed too many days in a row, they would hand
oh,
you this packet. And so you
okay.
had to pay to go to the doctor, pay him to fill out the documentation just so you can have
What?
another 4, 5, and 6 day off until you feel better.
Oh
And it
my
just
God.
became like, I live in a right to work state.
Okay. Okay.
So they can, and you're gone. And
Yeah,
so I saw the writing on the wall. I was like, they're going to
totally.
fire me. I'm missing too much time. It's just not working out. I was able to
Wow.
get on my wife's insurance, thank God, and things
Great.
started progressing forward. But you
Yeah.
can't take the time down. The employers don't want to hear that. Like,
Well, that the thing is, like, none of that is your fault, right? That is actually, but when you go and do these kinds of surgeries, like we're talking about as a trans person, you take, it's a 50-50, maybe even more chance that it's not going to work out in the long run. It might work out for 1 or 2 years, but all the people I have talked to, things start happening, like the hair growth happens inside the vagina because they didn't do the correct, right? And then this penis thing goes haywire. And I don't know if you've been noticing my ones I've been doing with these surgeries they've been
oh
giving these
God,
young girls that are
yeah. Hmm.
unbelievable. Can you even
Hmm.
believe that?
Yeah,
Can,
I mean, I have two scars, actually three, one up my
mhm.
spine, two, because the devices have a battery life. So
Okay.
every, say,
Okay.
with one, it's about every 5 years. With the other,
Okay.
it's about every 7 years. They
Okay.
reslice it open, plip,
Ooh,
plop, push it in. I wake up 5 minutes later, everything is good.
wow.
But these kids have been given the idea that it's like a haircut. If you
That's
get a
right.
bad haircut, just suffer through it and it'll be gone sooner or later, right? Or
Right.
shave your
Right.
head. This is not a haircut. This is
No.
a life altering, never gets to do again
Yes.
decision. And I don't understand why waiting 3 years is a bad thing.
It's not. It's what I did back in the day. We had gatekeeping. You had to go through
Yes.
years of therapy until you figured out this is really how this person needs to move forward. It's why I never look back 33 years, right? But now kids are doing it and changing their mind in a year after they already cut their boobs off because you don't have to get therapy. And what we talked about earlier, therapy is, oh, yeah, you're trans because you say you are. And then literally letting kids, that's mutilation, dude. That
Yeah.
is
My
100%
my
mutilation.
state a few years back moved buying cigarettes and lottery to 21.
Brilliant.
So they don't even trust
Brilliant.
18, 19, and 20-year olds to buy cigarettes and play the
Exactly.
lottery.
Exactly.
But these
Exactly.
kids at 14 are allowed to literally roll the dice and find out what's going to happen. Like, I
The
just don't
majority of them.
understand that.
None of us as adults understand this, dude, especially people who have had gone through things like you and I have, right? Yours being a way more intense than mine. But that being said, psychologically, mine's psychological. And if you're not even giving these kids any psychological help to sort of understand, you should never be in a hurry, especially this, right? Like, what are you in a hurry? They make them feel like they have to do it right now. And they're pushing them through this system that's so, you and I both know, man, it's going to come back tenfold on these doctors, on these activists. It's all coming out. It's all coming out. It's
I
like if
know.
they did surgery on you, half-ass, and they just didn't care, and then you were like, what, why did they do that? So, like, thank God they figured out the hair thing. So now the surgery for you has moved forward and it's much more advanced.
I am, I am, I am as good as I'm ever going to get right now when it comes
Yeah.
to function and form and the build.
Okay.
Maybe one day they will be able to control my pain a different way other
Okay.
than how I am now. That
Right.
would be awesome.
But it's
I
working though, right?
It
You're
is
have
working very
less
well.
pain. Yeah.
I have days where I describe to my friends having sex is sort of like getting drunk to me. It's fun while I'm
Oh,
doing it, but that
yeah.
next day it's going to be painful.
Oh,
That's how it is
wow.
for me. Now, I don't
Oh,
want to make up like I'm screaming on balled up on the floor.
yeah.
It means I'm probably going to spend a few hours on the couch
Yeah.
waiting for the meds to kick in, waiting for
Okay.
things to, get a little
Wow.
better where I can push
Sure.
on and stuff. But
Wow.
yeah, I'm not supposed to lift very much.
Oh,
Just from, and then every time I go, God forbid I have to go to the ER, they rush in and they say, how'd this happen?
Yeah.
And my wife and I always look at each other and start snickering. And we're like, well, how long do you have? Because it's 48 years old. When I went into the surgery one time, they couldn't find my file. They didn't know why they could not find my file. It was scheduled surgery, and I
Yeah.
showed up. The lady goes, "What's your name?" And I gave it.
Yeah.
Oh, and they go and get two large boxes on a mail truck and flop it down and said, "This is his file." And all the nurses were like, "That's him?" Like they were all waiting to meet the guy whose
Wow.
medical file was literally two cardboard boxes full. And that was
Wow.
15 years ago. I don't even know what it looks like now. Like it's like an Encyclopedia
Are you like
Britannica
a
or something.
case study? Are you like a case study?
I
Are you like,
actually have been.
oh, wow.
When it came to
Wow.
the spinal cord
Yeah.
stimulator, yes,
Yeah.
there was a case study done on. My insurance didn't want to pay for it. They said it's
Of
not
course.
proven. Oh, right. They said it's not proven for the type of pain he has. So they were able to finally kind of sneak it through like that.
Yeah.
But
Yeah.
yes,
Wow.
and I have spoken at pain conferences around. Yeah, and I enjoy it. I'm a fairly good, confident public
Yeah.
speaker,
I see that.
um, and I don't hide my face during that
Of course. Yeah.
because I'm dealing with
This is the
professionals.
internet, dude. It's
Yeah,
creepy.
right. And
Yeah.
honestly, if it wasn't for my wife, I probably wouldn't have a mask on. But I respect
That's
her
fine.
privacy way too much, and
Yes.
it bothers me that she may get found out from someone that we don't want. So it's her.
Yes.
That's why I wear the mask and the
Yes.
hat and stuff.
Yes.
But yeah, maybe one day they'll be able to treat my pain differently. But I'm satisfied where I'm at. Don't get me wrong. I'm pushing 50
Oh,
now, which is
I
like,
know, it's amazing. You
yeah,
seem,
like
I
where
know,
did it
because you
go?
seem you seem
You
so
know?
ground. Because I think really what I can say is, you sort of have to accept your fate, and that's just the way it is. And either you be a little bitch about it, like a lot of these young kids, or you just, you know what, you just kind of have to. Because what are you going to do about it, right? You could cry at home all day long. I mean, the pain part to me just. I, I know somebody who is in constant pain, and it's not fun to be in
Mm-mm.
like
No,
constant. It can actually drive you nuts, I
it's not.
think, right?
And oh yeah, and see, I didn't get here easily, like this peaceful thing. I
Yes,
I did a lot. If you've never heard of EMDR therapy,
I do that.
and that got me leaps and bounds ahead in the world of feeling better for
Excellent.
myself.
It's the
Once I
best.
started dealing with the past traumas, whether I
Yes,
knew about them or not,
yes,
things started to move forward in my life. But I am
great.
a huge advocate for EMDR
Me too.
therapy. Most people look at you like, "What are you? Is it hypnotize?" It's not
Nope,
that.
it's
It was
not.
developed for soldiers coming back from
Oh,
Afghanistan and
I
such, is
didn't
my
know that.
understanding.
I didn't know that
Yeah,
actually.
and it works wonders. And I can
It's a
honestly
game
say,
changer.
mhm, without that, I would not be anywhere near how I am now. So,
Wow. I'm actually going to tell my therapist you said that. No, she's changed my life, dude.
yeah.
Seriously, she changed my life. I'm a whole other person
Hmm.
now. I really worked on my anger. I had a lot of anger, like just from life, I guess. And she just, I would get road rage and she'd be like, just she'd teach me how to tap my steering wheel, dude. I would just pop right. I know it seems insane. I know people are like, whatever, dude. I
Hmm.
don't care.
Did you
I don't
use the
care.
light bar or the
Oh, yeah, I've
hand
used the
thing?
light bar,
I
but
use
I'm,
the light bar exclusively. Some
oh,
people like the
wow.
little things and the light bar.
Yeah,
I
sure.
use the light bar
it,
exclusively.
it's genius, dude.
Mhm.
Whoever invented it is genius
Mhm.
because it does work. So, I mean, anybody out there who is looking for something like that, I'm telling both of us sitting here today, just I swear by it. It's
I do
incredible.
too. I do
Yeah,
too. Hmm.
that's so
And it doesn't
awesome.
have to go on forever. It's
No,
not one of those things.
that's
You get to
she
move on.
literally is like
Yeah.
you're done,
You're
and then
not you're not required every week now to
yep,
tell your dad to do it. You
that's right.
will get better and
You
you will
will,
move on.
you
If you
will,
can if you can take it as
you will.
importantly as it needs to be taken.
I really want to just try to get it into the trans space, and get a lot of these young kids. Most of the kids who are transitioning are not trans, and they're just dealing with trauma, dude. They don't know how to deal with their own like trauma because nobody's helping them. They're just telling them cut your boobs off and take testosterone, and
Yeah.
you'll be fine. They're just adding to the trauma for these kids.
Hmm. Yeah.
Yeah,
Well, I mean, like I said, I wanted you to have some hope and fighting out
thank
there.
you,
You've
thank
taken
you.
on a massive problem, I
I because well, I have people like you also who back me, and I really, I couldn't sit with myself. Honestly, this worked out so amazing for me, and I feel a lot of gratitude for my life. But that's I couldn't turn my back on the children or the women, and so I appreciate you saying that. But I appreciate also you contacting me and having this amazing conversation, because I do think it could help. Even maybe somebody who has the same thing you have would be like, oh my God, somebody's talking about it, which is also a huge service to do to people who are dealing with something they're embarrassed to talk about.
Yeah, yeah.
Yeah,
As advanced as we are, we still are little children, and it comes to the way
totally.
we treat people, and
Yes,
it's like the old, schoolyard tussles, So
it's a thing.
maybe one day
Humans.
I'll be able to do this without a mask and hat
Maybe,
on, but
maybe,
for
maybe.
now, I don't think so. So
Maybe as things progress, but thank you, Toby. You're such an awesome person. Thank you so much for sending me all your cool emails too. I appreciate you a lot. Thanks for being very open and talking about something that is not always so easy to talk about. I do appreciate that you care about the people who subscribe to my channel. Thanks everybody for watching today. Leave Toby awesome comments and all of that. And then what if somebody wants to know more about this type of thing? Is there a place they can reach out? Or is there a website, or is there any
yeah, I
place?
mean, it's out there as soon as you
Okay,
type
just
the
Google
words.
it.
As long as they get this weird spelling right, it's gonna
Right.
pop up. Like I said, it's way more common than you realize. So
Yeah. Yeah. So I'll put information in the description, you guys. And thanks so much for joining us today. I appreciate it. Have a great rest of your day, and I'll see you guys all in the next one.